Hi, everybody. My name is Christopher Hall. I'm the president of Alternative Health Concepts.
And I'm Wendee Burnett. I'm a family nurse practitioner and the medical director at Alternative Health Concepts.
And we weren't able to do our live feed today because we actually had some technical difficulties trying to upload the stream. So we wanted to go ahead and make a video for you about our IV therapies and some of the reasons why we offer IV therapies. One of the main reasons we fall back on IVs so much instead of supplementation or different therapy routes like emotional therapies or colonics, massages, acupuncture is really because of the absorption of nutrients. It's something that we've seen a lot. People, when they take supplements, don't always absorb nutrition. A general rule of thumb is when someone takes a supplement, they usually get about 10% of the nutrients into their bloodstream. But when we do an IV of nutrition, we get 100% right into the blood, and we bypass all of the absorption issues that someone may have. And we see a lot of that with diabetes.
Right.
And especially just in aging in general, they're just not able to absorb as well.
Right. And the amount of people that are taking medication for heartburns and GERD.
There you go.
And that.
The PPIs.
Well, they're not all PPIs, H2 blockers.
Okay.
Yeah, the people that are prescribed H2 blockers or PPIs or decide to take them on their own because they have a little heartburn or upset stomach. This also affects the absorption of nutrients or supplement-wise or from their foods.
And then we have the compliance issue. So if the patient is supposed to, or the client is supposed to take a certain amount of supplement, but they forget because they're human and people do that. Or if they just get tired of taking it because they take so many other pills, Wendee can't help them to achieve the type of health that they want without consistency. And so when we have people come in, you know that the person is getting a specific amount of a specific substance and it's going to achieve a desired result.
Well, and they can achieve higher amounts of that supplement by taking it IV.
Sure. Yep.
So it becomes easy.
Mm-hmm. Yep.
To get it all in one sitting.
That's a major factor in busy lives. Is people want to have something that is simple and that makes their life easier. So, Wendee, what type of IVs do we have here at the clinic?
Well, we have quite a few IVs to offer. A lot of what we give a person depends on their physical complaints, their physical needs, results from a live blood test, or sometimes it's just a simple immune booster or just for general health. We have things as simple as coming in, sitting down for 15 minutes, getting an IV push of a Myers cocktail, which is very good for your general immune health and also helps with adrenal exhaustion, which we all suffer from our speedy, stressful lives.
True. Yeah, absolutely. And we have the glutathione IV push as well, which is very simple, just like the Myers.
Right.
I want to go through a list of the IVs that we offer here at the clinic. We offer vitamin C IVs. We offer hydrogen peroxide, alpha lipoic acid, phosphatidylcholine, which is otherwise known as Plaquex. We offer sodium bicarbonate IV therapy, glutathione IVs, EDTA chelation, Myers cocktail. We also have a pre and post operative micronutrient IV, which is very popular when physicians send their patients here. We have a macular degeneration IV therapy, and then we have the trace mineral IV and amino acid IV. So 12 different IV formulations, which, depending on the person's needs, is where you adjust the formulation.
Right. Right.
And
some of them can be given in combination.
okay, so that's something that when a person comes in, depending on their needs,
Right.
if the more severe the need, the more help you can offer.
Exactly.
And And one other thing I wanted to make sure that we covered today was not just an overview of the IV therapies that we have, but also kind of our mission at the clinic, that everything we do is for the good of the person, the good of the patient, and that we don't treat disease. And I think that that's something
Right.
that a lot of the people, when they come in, they actually read things online talking about how vitamin C cures this, or alpha lipoic cures that, or whatever the case may be. And some of these sensational tales that they find on these web pages, when they come in, we have to really straighten things out.
Right.
And
Right. And what we strive to do here is to help correct any deficiencies in the body
correct.
that open us up for disease,
Mhm.
open us up for genetic triggers that can cause disease.
Yep.
And we try and make the body stronger so that the body can heal itself, hopefully.
Yeah, and that's we refer to it as supportive care. We support the person throughout whatever treatment they're going through for their condition with their doctor. We don't want to take away from what they're doing with the physician. We want to complement that, and I think that that's really quite important too. Is that we offer things that will support the person through their normal treatment process, not take the place of it. But we kind of have a no BS approach. We're not going to beat around the bush and tell the person that it's going to do something that it's not going to do.
Right.
We don't want to give them false hope. We want to let them know exactly what the IVs do for the body, just like we're telling you today. It will help the body to heal. We're developing a foundation of nutrition so that the body can hopefully repair itself and regulate its functions. We like to refer to it as immunomodulation, to a certain extent. If we can put the right nutrition in, sometimes the body can regulate its processes much more efficiently. And then the other portion of that is that the majority of our business comes from referrals of either clients who are coming in or from physicians. The surgeons send their patients here prior to having surgery to build their body up. And we don't tell them, the patient, not to have the surgery. We want to help them through that process, and make sure that they actually have a very good surgical experience, and recover quickly.